Alright guys, so let's quickly talk about another thing, another aspect of this what's it called, pathology course or class of 18. So we just discussed cellulitis, and the next in line is the chlamydia. We'll be talking about the chlamydia this morning, this time around. So chlamydia is STI, the sexual transmitted infection that is common especially in the UK. And one thing you have to understand about this chlamydia, or about this particular infection, bacterial infection, is that majority of the ladies that do have it, or men that do have it, don't know that they have chlamydia. Like unlike other ones such as gonorrhea and then some other pelvic inflammatory disease, all gonorrhea to be precise. Not gonorrhea now, like a week after you are infected, you will be facing one or two challenges such as painful urination and other things. That actually define that this particular person, you have gonorrhea, you have been infected with gonorrhea. So if you come to chlamydia, you want to know. Then some patient, they will manage, the symptom will manage show up in after 2 weeks of what infection. After 2 weeks that he or she has been infected, some will be a month, some will not show at all. So what are the symptoms that we likely show if it must happen? There are the painful urination, will be there in man and as well in human. Then the vaginal bleeding and bleeding from the penile of a man as well. Then even bleeding from the anus self can be included. These are the types. These are the major. These are the major. What's it called? Signs and symptoms of chlamydia. And as time goes on, you will notice that there will be bleeding in the cervical center, and as well there will be bleeding alongside with menstrual flow. So these are the possible sign and symptoms of what chlamydia. You get. So just know that chlamydia is part of sexual transmitted infection that been transmitted through what sexual intercourse, intimacy, and these are the signs and symptoms that you can possibly see if you must see it, because the signs and symptoms, they are rare, as I've said earlier. They are rare. You hardly see them. I get the point. So if you must see them, these are the possible signs that you will be seeing, such as painful urination, both for men and women, both gender, and as well bleeding alongside with menstrual flow, and as well bleeding through the anus, penile, and vagina, and as well what's it called, cervical pain or injury. You get, this thing can happen like that. So chlamydia is a deadly disease that can also be treated by antibiotics. So you can use antibiotics in treating chlamydia in as far as you notice the signs and symptoms at an early stage. So it is best for you use bacteria antibiotics in treating them. So that is all. So let's quickly dive to another aspect of our course, our pathology class. So let's go, guys. We are done with chlamydia. Think the next one will be cervical cancer or the chicken pox. So in the letter C, remember. Thank you very much.